Hi everyone, I'm Dr. Deepu Chundru and I'm a plastic surgeon at the Hyderabad Gynecomastia Center, which is a unit of the New You Center for Plastic Surgery in Banjara Hills, Hyderabad. Today I'm going to talk to you about gynecomastia and its implications in men. Now, gynecomastia is nothing but an accumulation of fat and glandular elements in a male chest. So, if you take a cross section of the male chest, you have your muscle, you have your fat and you have your skin. So, an excess accumulation of fat and glandular elements in the chest is nothing but gynecomastia. Now, gynecomastia is also called as a male breast or simply as Moobs. We get a lot of people these days who think they have gynecomastia and a lot who actually do have it. Now, the incidence of gynecomastia in the present day is about 30% of all men. So, why do people develop gynecomastia? There are many reasons for this. The most commonest being a hormonal imbalance which occurs during adolescence or puberty, and that's essentially between 12 and 14 years of age. So what is this hormonal imbalance? Basically, every one of us has testosterone and estrogen, and an imbalance between the estrogen and the testosterone results in gynecomastia. The effect is very visible, and this gynecomastia may remain dormant or it may increase with an increase in the age. So that's when actually people become very conscious about it and they actually look for modalities of treating it. So apart from the commonest cause, which is hormonal imbalance, there are many other causes for which a person can develop gynecomastia. Number one, liver dysfunction and cirrhosis or even alcoholic liver disease. These all can result in gynecomastia, and eventually, this is where the clinical examination and history taking is very important. With these factors, we can actually determine an underlying problem as a result of which the gynecomastia actually develops. Another important factor is a testicular tumor. Some testicular tumors cause gynecomastia, and so actually you always have to correlate as to why a person has gynecomastia. Certain drugs like anti-proton pump inhibitors can also cause gynecomastia. So a thorough examination and clinical history taking is important to know why a person develops gynecomastia. Now, coming to how it can be treated, can it be treated and can it be treated well? Well, the answer for all these things are definitely yes. Gynecomastia is one of the easiest conditions to treat. It gives phenomenal results and it really boosts the person's psyche. Essentially, a patient comes to us with a problem and we take good history, subject the patient to a certain blood test to know actually whether every other organ is working well or not, and then we actually post the patient for a surgery. Now, a lot of people actually ask me whether gynecomastia can be treated in any other way apart from surgery. Gynecomastia, the only known treatment for gynecomastia is by surgery. There are no medicines that can help. Even if someone has a lot of obesity and has what we know as pseudogynecomastia, that's nothing but accumulation of a lot of fat in the chest, just like fat accumulating anywhere in the body. The commonest example for a pseudogynecomastia is the sumo wrestler, where the man is extremely obese and he also has a lot of fat in his chest. They ask me that whether exercise or dieting etc. can reduce the gynecomastia, but actually the answer is no, because the fat in the chest, even if it gets reduced, there's no way you can reduce the gland. So surgery is essentially the only treatment available for treating gynecomastia. Now, the surgery for gynecomastia is very simple. It involves a few hours in the hospital and a maximum of about 2 or 3 days rest from office or from college, whatever the case is. So the operation is actually done either under local anesthesia or under general anesthesia depending upon the size or grade of the gynecomastia. Grade 1, grade 2, grade 3 and grade 4, ranging depending upon the degree of gynecomastia and the size. Grade 1 and 2 can be treated with local anesthesia, but anything above grade 2 would generally require some form of general anesthesia. The procedure essentially takes about 1.5 hours, and it involves a combination of liposuction for removal of the fat and reshaping the male chest, and the glandular elements which are generally present below the nipple areola are removed through a small circumareolar incision on the nipple, and we excise the glands to give a very flat appearance of the chest. In gynecomastia surgery, we actually don't touch the skin. We are just giving small nicks or holes in the skin to remove the contents. So it's practically a scarless procedure, and no one needs to worry that this is going to cause a lot of scars in the future. Essentially, because we are not touching the skin or we're not excising the skin, we need the skin to shrink. Any amount of gynecomastia can shrink beautifully, just like how skin shrinks in pregnancy. It's the same way that chest skin will also shrink with good adequate pressure. So we ask the patient to use a pressure garment after surgery for about 5 to 6 weeks, and we combine this with good massaging from the 3rd week onwards for adequate skin tightening. A lot of people come to us saying that they're very scared about surgery. Does it have any risks? Is the anesthesia dangerous? Or is there a lot of pain involved, and do they have to have a lot of time away from office or work? It's not like that. It's a very safe procedure. There are hardly any complications that can arise due to gynecomastia because it's essentially a surface surgery, and the time required for recovery from this is extremely short. No one has to worry about pain because we have beautiful pain medicines which can control the pain to the maximum extent. A lot of people who have gynecomastia will not actually tell their parents about it. And the parents notice that they are reluctant to remove their shirt in front of everyone. They used to love swimming when they were very small, but then suddenly they withdraw from swimming. They don't like to get into a pool with others. They don't like to remove their shirts in front of others. And even if the child or the boy is quite tall, he actually walks with a hunchback, and they refrain from using t-shirts and tight shirts, etc. These are all generally some of the things which patients tell us that they have undergone. So all these things make the particular individual with gynecomastia very shy, very reluctant to make friends, and there's a lot of emotional factors which play on them, causing them to be not outwardly fine. So these are the patients who generally come to us, and once they have this simple procedure, they will be emotionally much better, and they'll be more confident about themselves. So a lot of people, especially the parents, they ask me whether it's really essential. I would say the best thing that you could give for your child or your friend or your brother would be a gynecomastia surgery, because it is essential. It's not purely a cosmetic procedure, and it is definitely essential because it is something which he cannot really explain, and it is something which will bring great relief to him. So a lot of people may be in areas where they don't have good plastic surgeons, or they don't have good facilities for treating gynecomastia. So actually, whether you really have gynecomastia or not, whether you want to know whether you have this problem or not, it's very simple. Nowadays you have technology. You can just send me an email or send me your pictures on WhatsApp so that I can actually classify your gynecomastia and really tell you whether you require a procedure or not. Because nowadays we see about 30% of all men having gynecomastia, we thought an exclusive center for treating gynecomastia is mandatory. At the Hyderabad Gynecomastia Center, we treat all varieties of gynecomastia. Till date, we have treated about 3,000 men with gynecomastia, and we do it very efficiently and without any issues whatsoever. If you have gynecomastia, please feel free to contact us either by WhatsApp, email, or just give me a call, and I'll really explain to you as to what we can do to resolve your issues with gynecomastia. Thank you.